Hello everyone. Welcome to today's session where we explore the medication Leukeran, also known by its generic name, chlorambucil. As always, this discussion is intended for educational purposes only. For specific health concerns or queries, it's essential to consult with a healthcare professional. Description: chlorambucil, marketed under the brand name Leukeran, is an oral medication that belongs to a class of drugs known as alkylating agents. Its primary use is in the treatment of various types of cancer, including chronic lymphocytic leukemia, Hodgkin's lymphoma, and non-Hodgkin's lymphoma. It works by interfering with the DNA replication process in cancer cells, thereby slowing or stopping their growth. Leukeran is often prescribed as part of a comprehensive treatment plan that may include other medications and therapies. Warnings: Leukeran carries significant warnings due to its potent effects on the body's cells. It is not suitable for pregnant or breastfeeding women due to the risk of harm to the developing fetus or baby. Additionally, patients with severe bone marrow suppression should not take this medication as it can worsen their condition. It is crucial to undergo regular blood tests to monitor your body's response to Leukeran, as it can cause severe decreases in blood cell counts, leading to an increased risk of infections or bleeding. Before taking this medicine: before starting Leukeran, inform your healthcare provider if you have any allergies, particularly to chlorambucil or any other alkylating agents. Discuss any history of kidney or liver disease, as these conditions may require dose adjustments or special monitoring during treatment. It's also important to inform your doctor about any current or past blood disorders, as well as any recent vaccinations, since certain vaccines should be avoided during treatment. You should not take Leukeran if you are pregnant or breastfeeding, or if you have recently received or are scheduled to receive a live vaccine. Patients with severely depressed bone marrow function or those who have recently undergone radiation therapy or treatment with other cytotoxic agents should also avoid this medication. Side effects: the side effects of Leukeran can be significant due to its mechanism of action. Common adverse effects include nausea, vomiting, diarrhea, oral ulcers, and decreased appetite. More serious side effects involve bone marrow suppression, leading to a decrease in white blood cells, red blood cells, and platelets, which can increase the risk of infection, anemia, and bleeding. There is also a potential risk of developing secondary cancers, such as acute leukemia, years after treatment. Any new or worsening symptoms should be reported to your healthcare provider immediately. Interactions: Leukeran can interact with other medications, potentially altering their effects. It is important to discuss all current medications, including over-the-counter drugs and supplements, with your healthcare provider to avoid adverse interactions. Dosage: the dosage of Leukeran varies based on the specific condition being treated, patient age, body weight, overall health, and response to therapy. Always follow your doctor's prescription and never adjust your dose without consulting your healthcare provider. Regular follow-up appointments are crucial to monitor your response to the medication and adjust the dose if necessary. Avoid: patients taking Leukeran should avoid live vaccines and contact with individuals who have recently received live vaccines. Due to its potential to suppress the immune system, it's also advisable to avoid contact with people who have infections. Ensure to discuss dietary restrictions and activities with your healthcare provider to avoid any complications during treatment. FAQ: patients often ask about the use of Leukeran in pediatric cases. The use of this medication in children depends on the specific type and severity of the condition being treated. It is crucial to consult with a pediatric oncologist to understand the risks and benefits in such cases. Closing: this concludes our discussion on Leukeran. Remember, the information provided here is for educational purposes only and is not a substitute for professional medical advice. Always consult with a healthcare provider for any questions or concerns about treatments. Thank you for joining us today.